You are listening to Unified Through Chronic and Mental Illness with your hosts, Angie Roberts and Kimberly Murphy. Please be advised that some of the topics of this podcast can be triggering and sensitive in nature.
The American Autoimmune Related Disease Association estimates that autoimmune disorder as a category affects 50 million Americans.
Hey guys, welcome back to Unified. This week we're talking about autoimmune disorder. It is Autoimmune Disorder Awareness Month, so we thought that this would be a great subject to talk about, partly because we know so many people with autoimmune disorders, having autoimmune disorders ourselves, and also being in support groups. But I never realized how many autoimmune disorders actually exist, Angie.
Yes, there are more than 80 different autoimmune disorders that exist. They often overlap, making them hard to diagnose. Isn't that crazy?
Yeah, well, I know my doctor's like, we have to rule things out before we can figure out what's really going on, especially when it comes to autoimmune disorders.
That's what I was going to say. And even worse, there is no single test that can diagnose these autoimmune disorders.
Right.
You know, your doctor, they have to use the combo of tests, and it's kind of like they kind of rule out a lot of stuff.
Mm-hmm. Yeah.
And so, they review your physical symptoms, and they do a physical exam, of course, to diagnose you. And also, the one test is a positive ANA that may indicate autoimmune disease. Sometimes it can be off. I guess I've heard that it can be a negative and it should be positive.
That's actually happened to a lot of lupus patients.
Right.
They get like positive and then negative and then positive. And a lot of it has to do too with what their doctor's giving them for medication. So, because a lot of doctors will diagnose you by medicating you and seeing if it works, because it's so tricky to diagnose.
It is. And it can take you years to get this diagnosis. It's very frustrating, y'all.
Yeah, it took me like 5 years to find out that what was going on with me was actually lupus. It was a process of elimination. I was actually treated for depression first because they wanted to get that under control so that they could see what pain and what symptoms were left, because depression gives you a lot of symptoms as well. And then it was like, we're testing you for RA. Nope. They tested my ANA and it was super high. So then we were on the right track after that. But that is usually the first test, I think, that most people have a positive. But sometimes it could take a while for it to show up.
Yeah, you never know. With diseases are just so hard. They don't just follow one pattern in one person. So It's really hard sometimes.
So what is an autoimmune disorder when you come down to it?
Well, I was reading in Healthline or on healthline.com, and it said that autoimmune disorder is a condition in which your immune system mistakenly attacks your body. Normally, your body can tell between foreign cells and your own cells, but not with autoimmune disease. With the disease, the immune system mistakes parts of your body, like your joints or your skin, as foreign instead of, just healthy.
Right.
And then it sends the auto antibodies out to attack the healthy cells, unfortunately. And so your body's being attacked and you're not sick.
That reminds me of the meme that's going around Facebook where it says, "I'm so badass, only I could hurt myself."
Right.
It says autoimmune disease on it or something like that.
Right.
Sorry, I had to say it. It's so funny.
No, you don't have.
But I mean, yeah, when your body actually starts attacking itself, that's really scary. And they also say that they run in packs, like autoimmune diseases tend to run in packs. So when you get one, you're waiting to see what the next one is.
And Kim, you have that issue, right, with your autoimmune disease. You have 2 or more.
Yeah, I actually ended up with a diagnosis of mixed connective tissue disease, which basically means that you have 3 connective tissue diseases So I do have three. Lupus is my main diagnosis, though, where I get most of my symptoms. But I also have Hashimoto's disease, and I also have a disease
what is Hashimoto's?
Oh, I'm sorry. Yeah, I have
That's okay.
Hashimoto's disease, which is a thyroid disorder. It's a lot like hypothyroid, which means the thyroid is running sluggish. However, in Hashimoto's, it can just switch and start to run high. So it kind of goes back and forth. So that needs to be treated with medication because, you know, the thyroid actually runs a lot of your body organs, which is surprising. I learned that it really does sort of run all the hormones in your body, like, you know, the chief or whatever of hormones.
Right.
And my third diagnosis is Sjogren's syndrome, which basically dries up your eyes. But I mean, everybody thinks it's just the eyes. It actually causes issues in your whole body. So,
does it dehydrate you, or?
Yes, it does dehydrate you. Like you'll have dry mouth, which can cause problem with your teeth, of course. You'll have swollen glands, which I have a lot. And then the dry cough, which I have commonly for myself. When I don't feel good, I start coughing all night. So basically, it just really affects the level of hydration in your body.
Oh, wow.
So those are the three that I have, and it basically falls into mixed connective tissue disease.
Gotcha. Yeah, I have IBS, which goes along with fibro. Fibromyalgia is not an autoimmune disorder, not yet. They're still trying to figure out what fibromyalgia is, really.
Right.
So they've got a few ideas, but they always have a few.
See, I always think of fibro as a autoimmune disease.
Immune, yeah.
It is so different and odd.
IBS is horrible, though, because it causes so much constipation, or you'll have diarrhea, one or the other, but it's like a lot of cramping and bloating. And I know y'all wanted to hear this.
Which reminds me of
Crohn's. Sorry if you're eating lunch.
Which reminds me of Crohn's disease, because that's very similar.
Right.
Yeah.
Right.
And that they're both actually serious diseases. I mean, people joke about it because it's, you know, but it is a very serious issue.
And then there's type 1 diabetes, and which I didn't know that type 1 diabetes was an autoimmune disorder.
It is.
So
and
you would know about that.
Right, because my son has type 1 diabetes, started at 8 years old, and they used to call it juvenile diabetes, but now they call it type 1. It is an autoimmune disease, and most people don't know that.
Yeah, I had no clue.
When your body attacks the pancreas, so yeah.
Well, that would make sense. And so RA, rheumatoid arthritis, also falls under this. I have some arthritis, but it's not RA. I've heard it's extremely painful with swollen joints and redness, and
they can actually test for that as well. That's one of the few that actually has a test. So
yeah, because they can see what kind of arthritis you have, right?
Exactly.
Whether it's rheumatoid or something else.
Yeah. There's some sort of test they can do so they can rule that out for people who don't have it. That was one of the first things I was tested for.
Okay. And then there's multiple sclerosis.
Yeah, MS is one that most people are more familiar with, but it's a disease where the immune system eats away at the protective covering of the nerve. So basically the nerve damage disrupts communication between the brain and the body, and everyone has different types of symptoms. Everyone's different, but vision loss, pain, fatigue, your coordination is off, you know, that kind of thing. And for anyone who's interested in learning more, we did do a podcast. It was season 1, episode 7, called Living Your Best Life. And it was with Kathy Regan-Young. And it was all about MS.
She was so much fun.
She was. Yeah, she was.
And then there's Graves' disease, which is pretty much like the opposite of Hashimoto's disease. Graves' disease is where the thyroid is overactive.
Right.
And so you get anxiety, and you may get sweaty and those kind of things.
And a lot of weight loss. One of my friends has Graves' disease.
Weight loss.
She has a really hard time putting weight on. Yeah, and her heart rate is really high.
That's scary.
It is scary because you can actually have a heart attack if you have too much thyroid hormone.
Right.
So definitely something that you want to keep track of if you have Hashimoto's or Graves' disease. You want to make sure that you're getting tested regularly so they can check out what your hormones are doing, what your thyroid's doing.
It's very important for them to know. It's
Yeah.
like she said, the thyroid kind of runs a lot of things. So
It does. Yeah, it really does. I was surprised to find out how much it did, but so I think this is one of the things that all doctors kind of test women over 40 for, just to make sure the
right.
thyroid is running correctly, because it kind of pops up around that time. I had it a lot earlier in life, but it usually pops up in like middle age.
They
So
check me because I'm overweight. They check me every
don't you
time.
just love that?
Yeah,
Oh
it's
my
great.
gosh. I don't
It's
even know what
great.
to say. I know there's so much I could say to that. Doctors and their weight thing. Like, seriously, come on, guys.
Right. Get it
Uh,
together.
yeah.
So there are a few early warning signs of autoimmune disorder, which are fatigue, achy muscles, I know,
Mm-hmm.
swelling and redness,
Mm-hmm.
low-grade fever,
Yep.
trouble concentrating,
Mm-hmm.
numbness and tingling in the hands and feet,
Hmm.
hair loss, and skin rashes.
And that's probably a short list
That is
because
a very short list because
there's
we didn't want to
much
make
more.
this. We
Yeah.
weren't going to make this an hour
I
podcast.
know we're gonna have people writing
We're
in, but
trying,
I have this symptom and this symptom. We know there's a lot more, guys. But these are the
right?
main ones. I think fatigue.
Well, now they say that this is the early symptoms, so I
Right.
think that this is when you're first getting it, maybe
Mhm. Mhm.
that this, and then as we know, symptoms just keep coming out of the woodwork.
Right.
So,
Yeah. A lot of people, like for me, and it's not on the list, but I'll just bring it up. Um,
mhm.
I was getting like ulcers in my mouth, which
Oh,
is very typical of lupus.
hmm
So yeah, like some really weird things can pop up, but these are like the general ones that most people,
hmm
somebody's always like, oh my gosh, I'm so tired. And we're talking tired where you're not just tired because you didn't get enough sleep. You're talking like you feel like you're walking through mud.
I
You're
have
just
literally just felt
fatigued.
like wherever I'm at, it doesn't matter if it's in the middle of public. I look at the ground and I'm like, oh, I really just want to lay on you right now. That's all I want
Right.
to do is I don't care if I'm in the middle of Walmart. I just want to lay here and sleep right this second.
Mm-hmm.
Like it's that. And before that, you had plenty of energy. And then
Exactly.
boom, the fatigue hits and it's like a brick wall. It's crazy.
I know, and it's hard for people who are just getting diagnosed, especially if they're married or they have a partner who's not sympathetic or doesn't understand, because they're like,
Right.
you say the word fatigue and they're like, well, everybody's tired. No, it's not that kind of tired. If
It's
you
a
have
difference.
somebody out there, have them listen to this and we'll set them straight because there is a huge difference. It's not the same at all. I just wanted to say that because I know so many women are suffering with fatigue.
Right.
Hmm.
We do know so many women that are suffering from fatigue. It's a it's really hard. It's in a lot of diseases though. I'm learning.
It is, and it's either pain or fatigue because pain is another one that people get, whether it be their joints or their muscles or whatever. And a lot of
Right.
times they'll say, what would you rather have, fatigue or pain? And a lot of women will say pain because with the fatigue, you can't do
Yes.
anything.
Oh my gosh, yes.
Hmm. So a lot of us would just rather have energy and deal with the pain. I know I feel that way. So, because it's hard, it's really hard to be bogged down like that out of nowhere. Okay, so somebody gets a lot of these symptoms and they're thinking, oh my gosh, I might have an autoimmune disorder. What kind of treatments are available? What can they do?
Oh, well, unfortunately,
Hmm.
there are no treatments that can cure the autoimmune disorder, but they can lessen the symptoms with overactive immune response the overactive immune response with medication.
Right.
So there are several medications that can help, but unfortunately, no cure.
That is
It's a
sad. And I
fact.
hope we get closer to that because I know that they're really trying.
Me
Um,
too.
for me, I'm taking methotrexate, which is like a light chemotherapy, and it suppresses the immune system, which suppresses my lupus activity. Um, And everybody's like, that's kind of strange that you have to take that. And then there's, people that mean well and they're like, why don't you boost up your immune system and you'll feel better? Well, no, I don't want to feed my lupus. That would be the worst thing I could do. So we have to be careful. We can't have like vitamin C a lot. All those like
homeopathic remedies.
Yeah, like what is that one that's called that everybody wants to take when they have a cold?
Echinacea?
Yes, that's the one. And people mean well. They want to help you out. But we have to remember that anything that bolsters the immune system is not going to help us if we have an autoimmune disorder.
Right. It's so sad that there's no cure for some disease, all these diseases that we have that there's no cure for. It's really sad. And
especially when you're talking about over 80, you said earlier. That's
over
insane.
80.
Yeah.
So there's over 80 types of things that can attack your body.
I know.
Your healthy body.
And I did
Isn't
read
that
somewhere,
crazy?
it is crazy. And I did read somewhere that if you have one autoimmune disease, you are more likely to have 2 or 3. So, which is not good news because, you get your first one and then it's like, okay, what else am I going to get hit with? But they say that's pretty average that you would get a couple more. So I don't know what
wonderful.
Yeah, I mean, I guess if you have an overactive immune response, then it would make sense that maybe it would attack different parts of your body, and that would bring up more issues, different diseases to hear, or different disorders.
Yeah,
so I mean, it does make sense, but
yeah,
ugh.
It's a lot. It's a lot for people to take on. Just one autoimmune disorder is hard for people to take on, and then you have to pile on top of that. Like, it's just too much.
And it's really hard on women, right?
It is really hard on women, especially under the age of 65. It is said that it's the top 10 reason that women die.
Oh, wow.
And so I'm guessing that's like lupus and that kind of stuff.
Right.
Kim, why do people die of lupus? Do they die of lupus, or is lupus an underlying cause of something else?
Well, I mean, basically, lupus will cause, the main concern is your kidneys.
Oh,
So
okay.
lupus can really affect your kidneys, and people tend to die from that if they die from lupus. Fortunately,
Gotcha.
because of modern medicine, it's actually rare to die from lupus, but of course we always hear, since we're in the support groups, we always hear of the people that do pass away. But the lungs play a huge role in lupus as well. You can get the scarring from issues with your lungs. So yeah, I mean, lupus is one of those tricky ones where, I mean, there's a lot of people who don't even believe lupus is a real thing. So,
Right.
but I mean, I think everybody knows who Selena Gomez is, and she had to have a kidney transplant. So, really it does attack your kidneys the most. So they do test your kidneys, they test your liver, they keep an eye on your ANA, and, they basically tell you to stay out of the sun and all the things that can ramp lupus up. And I think every autoimmune disease has those things that you can do to sort of prevent issues. Like with IBS, I'm sure there's foods you should avoid.
Yes.
That kind of thing. Yeah.
Definitely. And do I avoid them? Oh, sure, I don't.
Do I stay out of the sun? Not so much.
Yeah, I know. I'm sorry.
It's really hard, isn't it? It's hard. I think we get diagnosed with these things and it's really hard to take it seriously for a while. But then when it hits you hard and you're sick, you're like, why didn't I listen to what my doctor said? Because you feel so horrible.
Right.
Because it's not just medication, it's a lifestyle change depending on what you're dealing with.
So what are some other suggestions to manage your illness better?
Well, the American Autoimmune Related Disease Association gives some suggestions. They say that you need to understand your illness and your treatment plan. And you need to follow the plan designed by your doctor, which we both are guilty of not always doing.
Yes, and it's so important to understand your illness and how it works and your treatment plan. If you don't understand your treatment plan, call and ask the nurse. Ask the nurse when you're there. Ask the doctor when you're there. Whoever you need to ask, but make sure that you understand what they're talking about.
Yeah, I mean, and the wonderful thing is there are a lot of educators. For example, there are diabetes educators who will sit down with you and take the time to really answer all your questions about your illness. There are nutritionists that will help people where they could benefit from changing their diet. So, I mean, the doctors will help you, but you have to ask. Unfortunately, you do have to ask.
Right. Well,
So,
actually, I've never had to ask. Every time I go in,
really?
do you want a nutritionist?
Oh, well, no, you don't have to ask for that.
And I'm like,
But,
no, I'm good. I
well,
know
I
how
was
to eat.
just
I'm just fat. Okay, leave me
right,
alone.
right. I just was referring though to when my doctor was like, "You have lupus. Have a nice day. See you in 3 months." Because there wasn't even a pamphlet.
Right.
I didn't even get a pamphlet. So,
Oh,
um,
damn.
when people have to go home and Google it, it's just not a good thing. You have to talk to your doctor and just make them explain it to you and ask your questions. Maybe make a list when you go back, because I know it's a
Right.
shock at first, and just ask those questions. And don't be intimidated by your medical professionals. They
Mm-mm.
really are there to help you. And they work for you. Remember that. They work for you.
They
So,
do.
mhm.
Don't
Yep.
be scared to go and get that second and third opinion either.
Yeah, I
I
know a
don't
lot of
think.
people are kind of afraid of that, and I'm not sure why.
I think it's they're worried their doctor is going to get upset with them or something. But if your doctor gets upset with you about that, then I mean,
I
that's
know,
kind
and
of
they
his
kind of
ego
label
problem.
you as doctor shopping, and that kind of phrase started with pain pills.
Right.
But doctors don't like it when you start doctor shopping and then you go back to them. So I think that's kind of a fear that people have. But I mean, most professional medical doctors who really have your best interest at heart
Mm.
would encourage you to get a second opinion. So,
Right. Go ahead. Test
mhm,
my.
exactly.
Yeah.
And you got to learn to pace your activities no matter what you have,
Yes.
and rest when your body tells you to. And I know this is super hard for so many people because we've kind of learned
So hard.
to plow through things, to just push through. uh, I know it's hard for me to just rest. I always feel like I'm not doing enough and like I'm just kind of being lazy, but that's not what it is. If you feel that way yourself, it's hard to impress upon others how important it is for you to rest. If you feel lazy
Right.
yourself, it's hard to let other people around you know that that's part of your treatment. You really do need to take some time out.
Right. Yeah. It, like you said, it's very important that they know how to treat you.
Hmm.
And they don't know, a lot of people don't know how to treat you unless you tell them. And that's with any illness. That
Hmm.
can be with a physical or a mental illness. Like,
That's true.
you really need to tell people, this, how can you help? How, this is how you can help me when I'm like this.
Right. And it goes with that saying, you teach people how to treat you. And it's absolutely true. And you
Right.
have to understand too, like you feel guilty for resting. You also have to understand that you've done nothing to cause your illness. It's not your fault.
I think we all go through that period with it's kind of like a mourning period after you
Hmm.
find out that you have an illness because your life is just about to change or
Oh,
it
I
has
grieved.
changed already.
Yeah, I grieved my
Yeah,
old
you
life hard.
grieve your old life, right? And you can start blaming yourself.
Hmm.
And, well, what did I do to get this? And why did
What if
I,
I had done something different? Yeah.
right. And it's not your fault. These autoimmune diseases pop up and it's nothing you could have done.
Well, I mean, a lot of time they pop up because, you've had a different illness, like you've had a really bad flu, and all of a sudden it activates this autoimmune disease. There are so many ways this can happen, and they're still studying
Right.
it. Um, but it's not anything that you did.
One interesting thing that Kimberly and I have read, as you know, we've done 2 podcasts on COVID. There will be a third.
Hmm.
Um, we
And a
will have some,
fourth and a fifth, maybe, hopefully not.
right. But we're going to have some special guests that actually have long-term COVID, and they're going to let you know how they feel. It's a couple. So be ready for that. Um, we've actually read research that this long-term COVID could bring about autoimmune disease.
Hmm. Which is,
So,
I mean, I can completely understand how that could happen.
right, because they say sometimes with big illnesses, it will bring it on. So,
Right.
and it's really great to join a support group because they're really there for you. I don't know what I would do without my support group.
I know, me
Thank
too.
you, Kimberly, for opening it.
You're
Um,
welcome.
because I just sometimes I don't know where to go, and the main page of Facebook isn't where I want to put all my business. So
exactly. And I don't know what I would do without the support group either. I mean, you really need to be among people who get what you're going through, who have maybe been there before you, so they can tell you what they did. And even if you don't have the same illness, having an illness in general, there are a lot of things that people can still suggest to you, and just being heard is a lot.
I think that's a lot of what we do in our group. Like, we all know what we're supposed to do. So sometimes we do give, little tips or, whatever, but a lot of it is just support, oh, hey, I love you, hugs, praying for you.
Right.
If you need me, I'm here, that kind of thing. And it's wonderful.
So yeah, that's really nice. That connection is super important.
I think it is for everybody.
So Angie, what is the mantra for this week?
As a chronically ill person, I don't want to be told I can't do anything if I put my mind to it. I want to know that what I can do is enough.
Exactly. Yes.
We all just want to be heard.
Mm-hmm. And we want to be supported, and we don't want to feel less than. So, I mean, us going through a typical day is a lot different than somebody else's typical day. And it may not seem like a lot to somebody else, but it could be every little ounce of energy we had to get through it. So we have to be patient, and we have to be supportive, and we have to have empathy for each other. Whether you have an illness or not, there's probably somebody in your life that has one. And so hopefully this podcast helped, and you can support somebody in your life. There's probably a woman in your life that has autoimmune disorder, unfortunately.
Right.
And we hope that you will come back next week. We are talking about LGBTQ and specifically youth. So that will be a very interesting podcast. We're so happy.
It's a round table with some youth, so it's going to be great.
And they all have a different story.
So excited.
I am too. And please remember that we're stronger together, and we'll see you next time.
Mask up, guys. Peace out.
Unified Through Chronic and Mental Illness can be found at anchor.fm/unified. There you can find all social media links as well as other ways to listen.